अस्सलाम वालेकुम, वेलकम टू माय चैनल डॉक्टर शामी सेज। तो आज की इस वीडियो से SK18 सीरीज़ के पास पेपर में स्टार्ट करने जा रहा हूँ और ये क्विक रिकैप वीडियोस होंगी। सो लेट स्टार्ट। PT इज़ यूज फॉर फॉलोइंग genders. Question number 2, the person running the marathon race, blood flow to the non-exercising muscle is by the postganglionic sympathetic cholinergic. Question number 3, superior pole of thyroid is ligated artery supplying this originate from the external carotid artery. Eosinophilia in apoptotic cell is due to which of the following? That is, loss of cytoplasmic RNA. Carbonic anhydrase is present in the cytoplasm of the RBC. Question number 6, in mitral stenosis, where should doctor place stent for the auscultation? That is the left fifth intercostal space. Both cardiac plexus contain both sympathetic and the parasympathetic fibers. The special features of the cardiac muscle has action potential with the plateau. Female with the oligomenorrhea karyotype 46XX 45X nullo associated feature is gonadal dysgenesis. The patient is unable to open bottle cap. His sensory sensation intact on thumb and index finger. Which nerve is likely damaged? That is the median nerve. Individual usually has two creases. Patient having single crease in the palm. Anatomically it is the simian crease. Growth hormone need which hormone for the proper function? That is insulin. The pituitary adenoma surgery done through which approach? That is the sphenoid. The patient known case of the hypertension and he has stroke 1 year back with VN loss. Now his stroke and the VN is improving actively. He had complaint of the left homonymous hemianopia with left hemi special neglect. Which part of the brain is affected neuroanatomically? That is going to be the right parietal cortex. A 25-year-old female presents with the typical chest pain, dyspnea, and aggression palpitation. Clinical examination shows these findings. There is a grade 2 systolic murmur. Chest X is normal. The following is the most likely diagnosis. That is it is just the normal heart. Question number 16, the patient with the Addison disease present in the emergency with which complication? That is the hyperkalemic paralysis. An elderly obese man, the severe atherosclerosis, develops acute abdominal pain on laparoscopy. Small intestine were dark purple in color. Superior mesenteric artery were atherosclerotic and thrombosed. Mesenteric vein patent. This small intestine pathology will be called as the wet gangrene. Loss of dorsiflexion on the sensation of the lateral dorsum is due to the damage of the deep peroneal nerve. Next, a man, the taxi driver for the 3 years in return to Pakistan, presented the history of weight loss, anorexia, diarrhea, splenomegaly, jaundice and generalized lymphadenopathy. The etiology could be AIDS. Next, glial fibrillary acid protein is positive in the astrocytoma. Which of the following decrease the arterial oxygen saturation without decreasing arterial oxygen tension? That is the carbon monoxide poisoning. Schistosoma causes which of the following parasite? Urinary bladder infection. Killed whole organism used as vaccine for the pertussis. A young female diagnosed with MDR TB and taking second-line anti-TB drugs. After taking drugs, she has developed the enlarged thyroid and anti-thyroid antibodies. Due to which drug he has developed the thyroid problem? That is the hypothyroidism. That is ethionamide. Wharton Finkel's giant cells in severe acute pneumonia in the child is due to measles. The regarding myelinated fibers, the true is action potential at the internodes. Drug that increase the lower esophageal sphincter competence is metoclopramide. Which part of the intestine thick loop with less mesentery fat and the long vasa recta with her cadus surgeon asked for the uplifting of the gut during the surgery? That is the jejunum. Highline disease most important etiology is prematurity. Correct sequence of events for the neutrophil migration towards the site of the action, that is the margination, rolling, adhesion and the transmigration. Sulfur granules contain bacteria. Containing bacteria is that is the actinomyces. In histoplasmosis most commonly involved the organ is that is the reticuloendothelial system. Microtia is due to the defect of first and second branchial arts in the patient presented with the inability to write, read and understand. Most likely the lesion is that is Wernicke's area. 55-year-old male alcoholic present the symptoms of liver disease and found having the mildly elevated liver enzymes. Liver biopsy reveals the abnormal creation in the cytoplasm. Most of the hepatocytes of the following is the most likely cause of this? That is steatosis. Regarding visual tract true is all optic tract and lateral geniculate body. EEG of the patient show no wave because the patient is alert and conscious. The man standing in the bus suddenly move and man does not faint. Low how balance is maintained, that is the utricle. Next, the patient on the beta blocker presented the prolonged peer intervals of the following could be the possible cause is the which of the following, that is a drug induced first degree heart block, trally or trolley, whatever you may pronounce, occurs in 6 hours. Vitamin given with isoniazid is definitely B6. The pregnant lady with a mitral stenosis developed atrial fibrillation with drug can be given safely. IV heparin force expiration mainly through internal intercostal autoimmune disease against the single organ, that is Hashimoto thyroiditis. Drug of choice for the cardiogenic shock is the dopamine, the dobutamine. Next, 46, the 60-year-old patient generalized lymphadenopathy, platelets and TLC count raised, peripheral may show mature lymphocytes, that is the CLL. Cephalosporin mechanism of action is inhibited transpeptidase. Patient with the complaint of tingling sensation post thyroidectomy to the thyroid cancer. Which of the following is likely cause? That is definitely the tetany, hypocalcemic tetany. Primary immune system organs with the T-B lymphocytes form mature in which of the following? That is the bone marrow and the thymus. Patient of the 5 chromocytome of the BP control, which should be given. The options are missing, that is the phenoxymethylbenzamine. And from here option C, that is the both alpha and the beta blocker. Characteristic feature of the hemophilia is the tissue bleeding. Duodenum in its retroperitoneum has all except the first part. Lymphatic obstruction is caused by the inflammation fibrosis. Safe drug pre-operatively for the chronic liver disease is the fentanyl. Farmer presented with a migrating linear lesion on the foot. The cutaneous lava migrants. The patient came with the newly developed murmur. He gives history of having rheumatic fever in the childhood. That could be the mitral stenosis. Ventricular filling in which ECG segment? That is gonna be the TP segment. Next, the spirometry value goes down in which disease? There is the fibrosis. The patient showing improvement with the H2 blocker likely due to Zillinger-Allinson syndrome. Which of the following is used to calculate total body water? That is the heavy water. Thoracic duct starts at which level? T12. The embolus in one of the branch of the pulmonary artery causes the increased VQ. The patient with the transmural infarct died on 9th day. The cause is pericardial tamponade. Next, which of the following transport have the Vmax, that is the facilitated diffusion? HLA-DR4 associated with which of the following disease? That is rheumatoid arthritis. The patient after trauma, all muscle of the abdomen and the chest paralyzed, still breathing. Which level injury occurred below C5? Which of the following drug can cause the hypothyroidism? The lithium point, that distinguishing partial transaction of the spinal complete transaction, that is the spinal shock. The standard deviation Myers variability among the individual values of the following decreases the triglyceride level by the decreasing the availability of the fatty acids. There is a gamfibrozil where P wave is not present in ECG. Where is the pacemaker located? That is the AV node. Tissues unable to use oxygen is due to the cyanide poisoning. African woman with the raised AFP, the cause of the primary hepatic carcinoma is in this, that is the aflatoxin 1 in the dye. The sudden student examining the staining which shows the gram positive coca in the chain. Many attempts made but cannot be cultured. What other technique can be used to apart from it? That is serology. Cause of death in ARF is sepsis. If the patient 25% nephron is working, what will happen in the remaining nephron? Increase GFR in the remaining nephron. Which metabolic derangement is present in the progressive non-compensatory shock in which reverse phenomena fail? That is the metabolic acidosis and the respiratory acidosis. Which of the following is the qualitative change in the gene expression? That is the point mutation. The woman with the hypertrophied hypothyroid feature with the goiter diagnosed with iodine deficiency. Cause of the deficiency would be improper diet. Body metabolic response, trauma skeletal muscle response is by increased proteolysis. A woman has the cold intolerance, which test to be done in the hypothyroidism case? That is the TSH in the free T4. Next, the patient the renal artery stenosis may present the very high blood pressure to the increased renin secretion. The following structure in the kidney response for the secreting inadequate porphyrin and secreting renin. That is the juxtaglomerular cells. Intervention between the occurrence of disease in the lesion is the primary intervention. Next, 84, the 20 years old young boy presenting with the fever, headache, vomiting. He is having neck stiffness, ulcer mental status and hallucination, which is among the following the brain eating parasite, that is Naegleria fowleri. One blend factor disease, BT, and the hepatitis deranged problem in the platelet adhesion after third week of gestation, cytotrophoblast in the blood vessels and cells form. Type of the villus is the tertiary villus. Most common site of the choroid plexus papilloma in the children is the trigone of the lateral ventricle. Damage to the glossopharyngeal nerve leads to loss of which of the following taste sensation. They will be Charlie, which is the bitter taste sensation. Next, informed consent is important because it provides the participants with all information regarding risk, benefits, and alternatives. Feature of the acid-fast bacilli in the TB is the mycolic acids. Most important cells for the secondary intention healing is the myofibroblast. A patient was made to taste quinidine. The taste sensation carried by the ventroposterior-medial fibers. The patient developed the cirrhosis a few years after abdominal surgery, keeping with viral etiology, which is the feature that is the enveloped single-stranded RNA virus with the reverse transcript. The patient has the complaint of headache due to the high ICP-CSF is the example of transcellular flood not given orally because of the highly fast-pass effect inactivation by the liver, that is adrenaline. Imputation of the limb pain is due to the phantom pain. The nutritional status can be assessed through the albumin and the TABC. Preganglionic sympathetic fibers pass through ventral rami of the spinal nerves. PT-APT replenish after antibiotics used by giving the vitamin K. Next, in healthy man, metabolic requirements may exceed the oxygen supply, in which there is a skeletal muscles, and the maintenance drug and the myasthenia gravis is the physostigmine. Next, in hematemesis, vessel running in the ligament is not ligated. Which ligament is that? Is the hepatogastric ligament. A child develops night blindness and the presented to pediatrician, which one should be given to the patient, that is the retinaldehyde. Structure passing through the fossa ovalis is the great saphenous vein. Somatosensory fibers moving from the somatosensory to the parietal cortex, then to the frontal cortex is the coordinate movement of hands, eye, and face. Sequence predisposed to thrombus formation is endothelial injury, blood stasis in the blood constitutes change. Hemophilia diagnosed by partial thromboblast in time. Uncontrolled mitosis in the typical nuclei associated with neoplasia. Which one is false rib? That is ninth. In multiple myeloma, immunoglobulins are raised in the following order, that IgG, IgA, and then IgM. 70 years old man presents with myalgia, rash, arthralgia joints. Examination reveals no abnormality. Motor power fiber 5N is positive with speculate appearance. If anti-ribonucleoprotein RNP is also positive, then the diagnosis is the mixed connective tissue disorder. Strontium 90 causes which of the following? There is osteosarcoma. The patient presented with the fever, headache, muscle ache, and the rash. All symptoms suggesting rickettsia infection. The target tissue rickettsial infection is which of the following? That is endothelium. The grasp reflex in the babies is present up to CNS that is by the end of the 6th postnatal month. Athlete playing high jump now presenting the pain in the gluteal region. On examination, he cannot flex hip and extend the knee at same time. Damage to which of the following? That is avulsion of anterior inferior iliac spine. 116. Most common cause of death in the rheumatic fever is the myocarditis. The twin pregnancy with 2 ovum, which is correct? That is the separate amniotic sac. 118. Regarding melatonin, true is derived from serotonin. ANA specific for mixed connective tissue disorders. Best index of the preload is EDV in the left ventricle. Ovarian CA marker is definitely CA125. 60-year-old man presenting the complaints of hematuria, increased unit frequency in the stony hard mass felt. Is prostatic lymphatic drainage, that is the internal iliac and the sacral. Hereditary spherocytosis. Defective protein is the spectrin. Engineer working in the construction presented the platelet plaque. FVC decrease and ratio normal. This is asbestosis. Nocardia lung abscess treatment is trimethoprim sulfamethoxazole. The person got stab on upper arm and floor of axilla. Which of the following structure will be damaged? That is the intercostobranchial artery. The following nerve is damaged during the ligation of inferior thyroid artery. That is the recurrent laryngeal nerve. The patient during the RTS sustained sacral injury. He presented the overflow incontinent. What is the lesion? That is the parasympathetic. The child presented with the dark color nappy dark urine in the homogeneous state oxidase deficiency. What's likely the cause? There is alkaptonuria. Regarding the bronchial asthma, the most probable finding would be FEV into FVC ratio less than 75%. Next, the ectopic thyroid hormone is secreted by the squamous cell carcinoma of the larynx. The patient has the facial congestion, lung carcinoma, diagnosed to be small cell or cell CA. It will show increased ACTH. The in crescentary glomerulonephritis antibody complex deposition, the GBM, which type of hypersensitivity? There is a type 2. A person having DPT vaccine, he will have hypersensitivity reaction to the type 3. The pregnant lady in the first trimester having HbF 10, on third trimester HbF 9. Most likely it is due to the physiological change in damage of the gluteus maximus medius, which enzyme is later, that is the CPK. The patient presenting the semi-conscious condition with subclavian steal syndrome, blood supply to which artery causes this condition? There is the vertebral artery. The most radiosensitive tumor is the brainstem glioma. Autoantibodies against the parietal cells occur in the pernicious anemia. The patient with the severe headache, vomiting, and the neck stiffness, raised ICP on the lumbar puncture. There was blood stained CSF. Diagnosis is, that is the subarachnoid hemorrhage. Woman with the bee sting developed the swelling and inflammation. Most likely the mediator for it with the histamine for the treatment of the diabetic gastroparesis. Which drug is the most used for the prokinetic anti-allergic for the Down syndrome? The 11th week of the gestation is the CVS. The lady has a difficulty labor at the home in the village. She was brought to the house with a history of the pube bleed oozing from the gums. CB shows HB6 platelets 30,000, TLC 24,000, neutrophilia. The peripheral blood smear shows the blood cells. Her PT, FTT were prolonged. Most likely the cause the DIC. The child having history of the bleed lab shows the HbF 10 and the platelets 20, which is a likely cause. That is definitely ITP. Next, the second heart sound is due to the isovolumetric relaxation. Risk factor for the development of the malignant melanoma is the xeroderma pigmentosa. The furunculosis on the tip of the nose spread the cavernous sinus via ophthalmic when the contraction of the skeletal muscle involves activity of the large number of proteins required for the relaxation of the muscle is the tropomyosin. ECG of the patient with the electrolytes disturbance shows the U waves, the inverted T waves, prolonged PR interval in the ECG due to the hypokalemia. If the temperature of the set point increase, then there will be the decrease in sweating. Next, median nerve is damaged. Which of the following function of the thumb will be lost? Opposition, insulin dependent glucose uptake occurs in the exercising skeletal muscle. The antisera agglutinates with the B and D, and the plasma had NTA antibody. Which blood group it is? That is the B positive. The group of students were studying difference between the partial pressure of oxygen and carbon monoxide in the different arteries of the body. They find major differences between the aorta and the pulmonary artery, with the exception of the sweat glands. Parasympathetic system causes what? The promotes the secretions. The blood brain barrier is formed by the capillary endothelium. Patient has excruciating right leg pain. Anterolateral right leg cordotomy was performed. Which tract was involved? That is the left lateral spinothalamic tract. The small amount of the blood loss for the longer period of time with the low MC will lead to the microcytic hypochromic. The colleagues complain about a 30-year-old woman who forges signs on the important documents and search for the belongings of in their absence, has joined another company and they started smoking. He has a history of taking some drugs with a test to psychiatric evaluation. There is a urine screening for the toxicology. Mechanism of action of NSAIDs is the inhibit the arachidonic acid. The patient has the internal capsule Leon positive. Babinski sign. Which else will you find? Will find the peduncular knee jerk. Next, the physiological shunt will be present when VQ is 0. Turner syndrome karyotype is the 45X null. 26-year-old male presenting the surgical year after penetration injury to the right lateral chest examination when he inspire mediastinum moves to the left during expiration. Side shift towards left enhance. What will be the likely diagnosis? That is there is misprint here. It is tension pneumothorax diagnosis. Which drug is used in headache and contraindicating the peripheral vascular disease? Ergotamine. The most common initial presentation of the hemophilia patient, the bleeding from the circumcision side. Which hormone is responsible for the increased gastric acid secretion? That is the gastrin. Genotype in the child, what's true? That is the XXY, a true hermaphrodite. Aspirin at the low dose inhibit which of the following? That is inhibit thromboxane A2. In security, which of the following occurs? Plasma commercite tend to be low. Next, to a female with the heart disease, downward traction of the her AV valves cannot be made. Which structure is damaged? That is the quadrilateral right bundle branch of the conducting system of the heart is present in the septomarginal trabeculi. Right atrium infarction involves which of the following? Pectinate muscle. When light is reflected in the right eye, light reflex is absent in both eye. When it's reflected in the left eye, light reflex present in both eye due to Edinger-Westphal nucleus. The patient with the ethanol poisoning, what will be aniline gap. If sodium is this, chloride this, and the bicarbonate this, that is the 30. The congenital erythropoietic porphyria, what is the finding in the urine? Increased urine urophyrin 1. On in utero study, it's revealed that there is a absent vagina and the testes development of the scrotum. This is the testosterone producing tumor in the mother. The alcoholic patient develops the dyspepsia and the decreased gastric glands at the risk of the anemia. Stable angina, prolonged treatment is the beta blocker. Pressure that increase the heart rate, cardiac output, vasodilation, decreased TPR is norepinephrine. The site of murmur for the aortic regurgitation is the right secondary intercostal space. Patient presenting the shortness of breath, scratchy sound with no change in the inspiration. On echocardiography, pericardial effusion is noted. What is best site to remove the blood? There is subcostal with the needle angle superiorly. A lady with the cervical cancer of the 3.5 cm lateral and the lymph nodes are enlarged with suspected metaplasia. The staging classification would be T2N1 M1. A burn patient, there is a fever, bleeding dialysis, and the hypotension. The diagnosis is the DIC drug not given. The renal decompensation disease is the gentamicin, which is the following is inorganic compound in the carcinogenic, that is the asbestos. 40-year-old man in the ER complained of body weakness, degree, a history of taking some drug for the weight gain. Report urine specific gravity is 1.010. Urea creatinine is raised. Urea calcium is raised to. Likely diagnosis the nephrocalcinosis, the transmigration of neutrophils along the strong endothelium, that is diapedasis. After cut in the skin, bacteria enter, it cause inflammation.